Hello and welcome. My name is Darren, and I'm one of the marketing coordinators with BCIT's School of Health Sciences. And it is my pleasure to welcome you to the Health Sciences Information Session for the Health Leadership Advanced Certificate Program. First, I want to say how happy we are to see you tonight, and thank you for attending our presentation. And just before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. And now I'd like to introduce Shan Chattoglou to introduce the department and speak about the program. Welcome, Shan.
Thank you, Darren. Next slide, please. Yes, so my name is Shan Chattoglou. I'm the program head of the Healthcare Management Department at BCIT. I've been a faculty here at BCIT for over 20 years. I started when e-learning was taking off in the early 2000s, and gone through a number of roles in the institution, from research to health leadership to various chair and committee roles at BCIT. So my role is to oversee the department, to support our students, and to train and support our faculty who teach our courses. The mission of our department is we inspire and educate health leaders who wish to develop their leadership and management skills to foster a positive change for a sustainable health system. And so my role in our info session today is to walk you through the features of our program, share a little bit about the background of our students, and then to handle some Q&A. So we are going to kind of accelerate our info session a little bit and get right into the presentation, but there'll be plenty of time for Q&A at the end if you have questions, which I'll be happy to address. And as well, after the conference, we'll be sharing my communication information, and you're welcome to reach out to me directly. So next 2 slides, please, Darren. Go ahead. So from our perspective at BCIT in healthcare leadership, we are situated in the School of Health Sciences at BCIT. So we have a very health and clinical perspective. Our vision for the future of the Canadian health system is that the future will be more patient and family-centered, more prevention-oriented, shifting away somewhat from hospital-focused care to community-based and primary care, more accountable, more interprofessional with teamwork, and our population is going to be aging, so we'll be increasingly serving an older population. So oftentimes an important question that comes up is, for supporting change in the Canadian health system, who are going to be the clinical and the non-clinical leaders to enable this change? So if we look at Canada compared to other countries, Canadians, we often feel that we're pretty, at the top of our game, doing well. And oftentimes that's because we compare ourselves to the United States. But from a global perspective, Canada is actually not at the top of the list in terms of health system performance. This chart is from a 2021 international study of health system performance, where Canada and other highly industrialized countries are compared. And you can see in this chart that Canada's overall ranking out of 11 is number 10, and with the US at the bottom. So although it's really convenient to compare ourselves to our neighbors across the border, we should be thinking more broadly than that and comparing ourselves with other countries like the Netherlands, Australia, UK, and so on. And this is just another chart showing how Canada compares to other countries kind of in our sort of industrialized nation neighborhood. Here we can see that Canada, in terms of health system performance, it's kind of in the lower range in terms of the overall ranking. So you may recall earlier I introduced the Healthcare Management Department and our vision for the future, shifting towards community from hospital-based, and a number other of attributes in our vision. We can see here from the British Columbia Ministry of Health Service Plan spanning for the next 3 years. These are some key areas where healthcare needs to move to advance and support a sustainable system. So oftentimes, if you want to know what priorities exist, you look at how many priorities there are and what's at the top of the list. And here, there's only 3 goals that are specified for British Columbia healthcare system. Goal number 1, focus on improving service delivery areas that require strategic positioning. So this is about redesigning. You can see those keywords in the red, moving towards primary care, integrated team-based care, seniors, community, mental health, substance abuse, and so on. Goal number 2, support the health and well-being of BC through a delivery of high-quality services. So population health, health promotion, improving hospital, pharmaceutical care, and so on. Goal number 3, deliver sustainable public health care. So equity, engage workers, and also making skilled use with the resources that we have, choosing wisely among services, and being effective with our resource use. So oftentimes when there is a high demand for change, or where there's some opportunity for improvement, or something that we don't agree with, that we dislike, we may see it in the news. Oftentimes there's a lot of finger pointing, and the finger pointing is towards leadership, and we just need better leadership. But oftentimes that's also a little bit of a vague term. Here's a quote that I think is pretty funny, but in some ways it's kind of reflective of how we as a society responds when we talk about leadership. Leadership is like an abominable snowman whose footprints are everywhere, but who is nowhere to be seen. As well, if you walk over to Chapter's bookstore or look up leadership on Amazon.com, you will find so many texts and books of different variations of the word leadership. Quantum leadership, design leadership, leaders on leadership, practice of leadership from Billy Graham or Attila the Hun, or leadership scorecard, and on and on. So it's a fairly complex, it's a popular word. But from a healthcare management perspective, it's really important to take the definition of leadership and make it your own, and work through your own vision as to what it means to be a leader, and have some of a roadmap for yourself if this is an area that you would like to pursue. So this is a definition of leadership that that I like, and I just wanted to share that with you. Leadership is accepting responsibility for enabling others to achieve a shared purpose in the face of uncertainty. Okay, so let's talk about the Healthcare Management Department at BCIT. As I mentioned earlier, we are a program and a department that's based in the School of Health Sciences. Our school has over 30 different programs, from entry-level health professions to advanced practice programs. And our department has been running healthcare management as a field at BCIT for over 30 years. So back in the 1990s, we offered a healthcare management level 1 and 2. These are certificates that used to be taught in a classroom weekend-based format. And then over the years, they moved to a paper-based format. And then in around 2000, when I got involved, a lot of our programs moved towards online delivery. So we had programs in clinical research, informatics, quality improvement. And in the last 10 years, our flagship program has been the Health Leadership Advanced Certificate, which in a way, it consolidates and optimizes delivery of our previous curriculum, but in a more focused and direct manner. And this is what we've been doing since 2013. So our students in the program, this is a pie chart of the backgrounds that our students have. These are all people who are in the field. You can see from the left bottom corner, about a third of our students have diplomas in technology and health sciences, and many of these people are alumni of our School of Health Sciences, so the allied health technologists in medical laboratory, imaging, and so on. We also have students in our program who have come out of health sciences programs with bachelor degrees from BCIT and elsewhere. About a quarter of our students are RNs. They have a BSN usually degree or additional training in specialty nursing. And then on the bottom right, we've got a few students, around 6 to 10% of students who have mixed backgrounds, ranging from master's degrees in various areas, Masters of Science, Masters in Nursing, Nurse Practitioner, MA, and PH, and so on. So we've got a real great mix of students in our program in terms of their academic background. And then in looking at our students in a kind of another dimension, looking at by the field of expertise, we've got nursing, MRI techs, med lab, clinical genetics. All these areas in blue are actually alumni areas of BCIT. So we teach into these for our undergraduates in our school. And many of these people have come back for further studies. But in addition, you can see in red, these are other areas in healthcare that we don't teach at BCIT. They come out of UBC, SFU, and across the country, but they also come to our program. So it's a really great interprofessional learning environment. You can see some of the other areas that have been really important in recent years: respiratory therapy, pharmacy, gerontology, health, IT, and so on. And in terms of the age backgrounds, people are kind of in that first half of their career. They're not fresh out of school. They've usually got some experience, 10, 12, 7 years of experience. The average age of our student is around 36, plus or minus 8 in the first standard deviation. Okay, can you click through a few of these, Darren, please? 1, 2, 3, 4, there, that's good, great. So I just wanted to share with you that taking a program like BCIT's in health sciences, particularly the advanced certificate programs, these are programs that you would take as you progress in your career. And in this case, for today's info session, a program in health leadership. So usually at the beginning of one's career, right after high school, people do their post-secondary education, and then they get into a field. Oftentimes, there's a lot of churn in life, moving, getting settled, maybe moving to another area, getting a new job, kind of getting to know your organization, maybe changing jobs a few times, maybe doing shift work. But after a few years and then getting settled, one becomes more kind of an emerging professional who knows the organization, knows the practice, might even be having some junior colleagues who you're supervising. And at that point is a great point to take a program like health leadership, because you're in a situation where you know you need to learn more and you know what you've learned to get into your field, but you need some kind of additional learning and maybe connecting with others to get to the next level. For advancing and leading in your organization and participating in change. So that's the area that we focus on for this program. Okay, so that's why we offer the Advanced Certificate in Health Leadership at BCIT. So the Advanced Certificate in Health Leadership is a program that's offered fully online. It includes 8 courses spread over 2 years. That's 24 academic credits. The level of study is upper baccalaureate level. The program is based on a competency profile called Leads in a Caring Environment, and I'll speak more about that later. After completing the first half of the program, after completing the first 4 courses, you get a statement of completion. And then after completing the final 4 courses, so that would be 8 in total, you're awarded the Advanced Certificate in Health Leadership. To get into the program, it's really important to have either a health sciences diploma or a bachelor degree in any other field with work experience in healthcare. And for English level proficiency, the standard is 73%, or the equivalent to a B in English 12. Essential for success is to have enough work experience in your field that you can relate the learning to your world of day-to-day practice, and also to be a contributing member of the class by bringing your experience into the interactions that we have in class. People should be in a kind of a place in their career where they have enough latitude that they can try some of the leadership techniques in the organization, because there's a kind of an understanding of how to get things done in the organization. So you should be gainfully employed in a relevant area of the health sector, or have knowledge from other sectors that you can transfer into health and into your learning in the program. So here are the 8 courses in the program. You can see from the first year, we've got a course in fundamentals for emerging health leaders, the Canadian Health System course. This is a health policy course that describes how healthcare is done in Canada. For people who are changing provinces or coming to Canada from another country, this is a great course because it gives you a sense of what are the major trends in Canadian healthcare, where are the major needs, and how you can kind of position yourself. The third course is Leading Health Professionals. So this includes human resource management, labor relations, teamwork, and a number of other topics related to people in healthcare. Leading Sustainability in Healthcare is a financial management course. So how do you manage operating and capital budgets in healthcare? What does a budget for a department look like? And what are some management techniques for managing a budget, as well as the soft side, so working with people, politics, and other issues related to dollars and cents. Year 2 starts off with a course on performance management and measurement in healthcare. Then a course on evidence-informed decision-making. If you have a clinical background, you might remember the term evidence-informed practice. So using scientific evidence to decide on clinical interventions or deciding on best ways to give and provide treatment. In this case, the focus is on health leadership. And, in organizations, the science of organizations is really more challenging than the sciences in the biomedical areas, because it relates to people and organizations, and nothing really kind of stands still when you want to analyze it. So this is a course on how to use evidence as an emerging health leader to support decision-making, setting policies, setting directions, and also to achieve results. The third course is project leadership in healthcare, so project management and project leadership. This is another great course that people use when, oftentimes, if you have a clinical background, you may be called upon by colleagues in non-clinical areas or other areas to provide your input, say, for example, to do with workflow in nursing, or involving the patient voice, being an advocate for patients. Oftentimes people with a clinical background feel like, well, this project is not really going in a direction that it really should, based on my experience. How do I contribute? So this is a course that helps you to understand project management, so you can be an engaged participant in the process and maybe even lead it. The last course is a Leadership Integrative project. This is a capstone course that you do in your organization. So with an organizational sponsor who's interested in solving a particular problem, you lead the sponsor as well as BCIT through an applied project that addresses the issue, gives some strategic recommendations, kind of a roadmap of how to proceed, and also acts as kind of a stepping stone for you at the end of the program to illustrate your new skills and make new connections. In terms of the teaching and learning strategies that we use in our program, it's really quite diverse. I didn't know about you, but when I think back to my undergraduate level studies, certainly we did do individual and team work, but that was before internet and before some of these new teaching and learning methods come out. In our program, we include individual coursework that you do on your own. So like really short assignments, long assignments, projects that you do by yourself, discussion postings online that you do by yourself, as well as team projects. So group seminar discussions, group peer-to-peer coaching, group essays and projects, case studies. So we have a whole range of teaching and learning methods that we use in the program, but we are very cognizant that as a health professional, you're very busy with your day job and you may have a lot of other commitments. So we strike a balance between individual and teamwork. Usually at the beginning of the program, there's more individual work with kind of a lightweight sort of teamwork. And then as you go through the program, teamwork is used more and more. And this is very appropriate for a program like this because it is a program on health leadership, which is in some ways very much a contact sport. You're interacting with others. So the Integrative project, this is the capstone course that I mentioned earlier that comes at the end of the program. And I just want to speak to this so that you get a sense of what this is about and why it's so important and special for a program like ours. So like I said before, there are three participants involved: the student, the organizational sponsor who would like to see a certain quality improvement or a certain change be achieved, and then the academic facilitator, that's me from BCIT. And so together, this panel of three participants examines, uses evidence, and provides recommendations to the organization, but the student leads the process. In addition to the three persons on the panel, there's also a placeholder, an optional invited guest. So if, say, for example, you're in a department that's going to undergo a sort of accreditation, but you have an opportunity to connect with the accrediting body, maybe to involve some of those standards into the process of looking at the project. Other examples could be, it could be a quality improvement project, say to reduce polypharmacy, and you are able to connect with the BC Patient Quality Council because they have a quality lead who is interested in this topic. There's ways to have another subject matter expert be involved as supporting the project, as well as internally in BCIT. Like I said, this program is based in the School of Health Sciences. We have specialty nursing in a large variety of areas, medical laboratory, imaging, a whole lot of different areas, as well as outside of our school. So operations management, information technology and computer science, ecology and sustainability. So there's a large number of expertise that we can access through BCIT to be kind of an invited guest on a project like this. So maybe we can speak more about this project later, but it is one of the highlights of the program, and it's the final course in the program. In terms of the project, some ways of a few years ago, I reviewed the projects that were completed and just wanted to share with you some of the common themes that had emerged over the last few years. So in the left column, you can see oftentimes the areas that the project focuses on, the domain areas, relate to the areas of practice, so nursing, pharmacy, medical imaging, and so on. And in the right side, these are common applications for the project. So these are specific kind of topics or interventions. So looking at workflow and process improvement, information and data, looking at program development and evaluation, looking at the health human resources, the healthy workforce. This is really a pertinent topic right now because of after effects of the COVID pandemic and the burnout that's being experienced in the health system, the shortage of the workforce. Training on onboarding, actually quite related to healthy workforce, but how to bring in new people into the department and make sure that they're situated properly and well supported. Standards and guidelines, organizational change, patient voice. That's another topic that's really important right now, involving those that we care for in health services to be having a voice in directing the services. So here we have just a kind of a number of topics of past projects that I wanted to share with you. And we'll be sending out the slides later, so you don't need to remember all this. But some of the interesting ones that had emerged in recent years, the first one on the top left, how to preserve the specialty nursing expertise within Burnaby Hospital, trying to prioritize the use of these really key resources. Other topics here, patient self-medication administration policy, so risk management related to pharmacy, using lean and Kanban processes for quality improvement, some reorganization, so the some reorganization of services. The one on the top, second one down from the top right, looking at quality improvement projects, what has been learned at Providence Health Services Authority, and scaling those lessons to across BC, and so on and so forth. Next slide, please. And again, really detailed topics on a number of areas. You can see from the titles that these are really quite nuanced and detailed. And the reason they are is because they emerge from the students' own experience and also their organizational context. And that's why it's really important to be kind of a foot in the door in terms of your career, being in a good place to be able to advance further through a program such as BCIT's. So the faculty in the program includes full-time faculty and sessional instructors from across the health system. Faculty are at director level or senior level roles with master's degrees in various certifications and a broad range of experience. We're endorsed by various professional bodies and industry associations. Next slide. And within BCIT, we're fairly well connected. So on the left column, you can see some other programs who actually use our courses as electives or as required courses. Bachelor of Health Sciences in Medical, in MRI, Digital Health, there's Analytics, Technology Management, and Project Management. And those are from different schools as well as health. And on the right, we have information sharing partnerships with the Emerging Health Leaders and Railroads University. Okay, this is a bit of a busy slide, but this is the annual calendar of our department. So you can see on the left column, the list of courses, the 8 courses in the program. And then our schedule for running our department is optimized around a January start. So for example, this January in 2023, students would have taken 2 courses. And then in April, the current term, they're usually taking 1 course, and then September 1 course, next January take 2, and then 1, and then do the final integrated project at the end. That's the line you see there in orange. And so that's the typical 2-year schedule for completing the program. But as you can also see that there are these lines in green and lines in blue. So basically we have an annual start date around January. There are also additional offerings of the courses. So for example, the HLED 7110, that's the fundamentals for emerging health leaders. It's actually offered every term. So January, April, September of 2023, and then January, April, September of 2024. So it's actually offered all the time. And the reason for this is people may want to start a program like ours early, so do a couple courses and then get into a cohort in January, or maybe they need to take a term off to move or start a family or something, and then want to continue later. So by having these additional courses into our offerings, people have flexibility to go a little faster or to take time off and then return later as they go through their studies. So the program is a 2-year program. But it is possible also to go faster, go slower, get extensions. We're here to support you with that. So the cost of the program overall is $8,128. So it's just over $1,000 per course, including the textbook. You can see in the middle column there, the price of texts do vary across courses. They are kind of bunched up in the first course at $256. And the reason is there's several references that are used in that course, but also used in the other courses in the program. So that's kind of bunched up near the front. But going further past that point, the average textbook price is somewhere between $46 and $94, including a couple courses where the texts are actually fully provided online free through the online course. In terms of the value for money for a program like this and comparing to other institutions, The price point is higher than what you had experienced in your undergraduate studies, and that's because undergraduate studies are approximately 50% or more subsidized by tax dollar. So this advanced certificate is designed for working health professionals, people who are in the field already and have a source of income to fund their studies as well as all their other commitments in life. So the price point there is going to be more than undergraduate studies. However, it's much less than what you would experience in graduate studies education at the master's level, particularly in like an MBA program or an EMBA program. So the pricing is kind of right in the middle. And the reason is it's to be highly accessible to our audience, which is a large swath of health professionals who are in the field. The aim for BCIT is really not to be the exclusive top of the pyramid sort of program that's funded by one's corporate employer. It's really aimed to be kind of broad and accessible for all populations. Okay, so let's assume that you're interested in the program. It's really important to focus on, what are you here for? What are your expectations? And how do you know that you're proceeding? So in terms of progress, if a person is in the program, we identify them as a student who's being accepted into the program. That means that you've done a formal application for admission and you've been accepted. There's also a few students who are interested in just a few courses. They might want to take the project management course a la carte or the first course. And for these students, we call them undeclared majors. So they are students at BCIT, but they're just not declared and intending to go through the whole program. So there are these two sort of categories of students. I would say it is important to be accepted in a program if you intend to do it, because when there are opportunities, let's say there's a conference that comes out with a discount code for students, or we're going to send a referral to like a mentoring workshop done by colleagues in industry, we know who to send this communication to because these students are in the program. So we know how to communicate with them. The people who are kind of a la carte, just taking a course here and there and maybe not really thinking about the whole program, it's much harder to track those people. And so it's much harder to support them. So if you do intend to be in the program, you'll get a higher level of attention from our department because you're kind of really involved in the process. So if you are accepted into the program, the expectation is the first milestone is that you take your first course pretty soon after getting accepted. So don't get accepted into the program and just don't start at all. It's really important to take your first course while your motivation, your curiosity is really at its peak because you just applied and got in. The second milestone is to complete the first 4 courses in the first year. The third milestone is shortly after that point, start thinking about your integrated project, have a discussion with me about potential topics, potential sponsors, and maybe have a plan for identifying a suitable project over the next year. Then the final milestone is to complete your integrated project at the end of the program and get your advanced certificate. And if you decide to be an undeclared major, maybe you really just wanted that project management course, or maybe you're not sure if this is the right time in life to take a program like this. I suggest that people try to take a course every term or have a discussion with me, give me an update as to what your intentions are. Unlike when a person is in their undergraduate studies and everyone is kind of in a similar stage of life and school is the #1 priority and the only major priority. When you're doing studies as a working adult, you're juggling a lot of other commitments. So it's really important to have accountability with your friends and family, but also with BCIT. We're here to help you with that. So if you do decide to proceed as an undeclared major, stay in touch with our department and check in from time to time. Okay, so next steps. Courses run in January, April, and September, and the applications to get into the program occur year-round. Several courses in the 8-course program. The first one, the Fundamentals for Emerging Leaders, the second course, Canadian Health System, and the seventh course, Project Management. Those courses can actually be taken by people who are in the program as well as people who are undeclared majors. So they had no intention of completing, but they were just interested in that course. So people can take those courses even before they apply to the program. If you need some advice as to how to get ready and maybe to understand some of the program description, you can get assistance from program advising at BCIT, as well as you can reach out to the healthcare management department and request an assessment, just a quick and informal, some feedback as to if you think the program is for you. So some excerpts, these are kind of like testimonials from students in the program. I'm currently in X-ray tech, Vancouver Island. Easy to get caught up in one's own specialty. So looking forward to learning from people in different backgrounds. Nurse clinician. I remember this student. She's a supervisor for a mental health department in Quebec. Being kind of an experienced nurse, working at a fairly high level capacity, also taking on junior nursing students, and being able to be a preceptor and a mentor to those students. Nuke Med Tech, 8 years working as a technologist, 2 years in emerging leadership role. Challenge is being the leader, but also the youngest in the department. So it kind of creates an interesting kind of work setting there. Same story, being a young leader, supervising others who have much more experience. So these are some examples of students in a program who are giving some feedback as to, why they got into the program, how it's helping them. Oftentimes people are in a place in their work life where they need some extra knowledge, extra learning, and extra credential. And so they reach out to BCIT for that advancement.
And just to build on what Maggie put in the chat here, please contact program advising if you have a question or unsure of something. They are able to answer questions regarding entrance requirements, the application process, student resources, success strategies, program schedules, and many other details as well. And advisors are available to assist you on specific days by telephone, email, or in person, or by virtual appointments. And please go to their website, bcit.ca/advising, for the most up-to-date contact information and service hours. And if your inquiry is time sensitive, please call them during their telephone advising hours. And this is the best option to get your questions answered quickly.
Okay, Maggie, do you have any other final remarks? And also Victoria, if you have any questions.
No, I was just going to say thank you, Shan, for the amazing presentation. That was great. And yeah, as I put in the chat, you can email us at program_advising@bcit.ca if you do have any quick questions that you just forgot to ask tonight, and we can definitely follow up on that with you. Currently, our turnaround time for email actually is very quick. So email or phone are both really prompt ways to get in touch with us. So thank you again for attending.
And I just wanted to acknowledge my colleague, Victoria Banham, who Victoria and I work closely together in the healthcare management department. When you email hcm@bcit.ca, both of us received the message, so it'll be one of us responding. Is that right, Victoria?
Excellent. Yes, correct. Thank you. Yeah.
Okay.
Well, thank you, Shan and Victoria and Maggie. And I just want to remind everyone that a copy of the slide presentation and a link to the video recording will be sent out to all registrants sometime next week. And we want to thank you all for being with us today. And we wish you all the best in your future in health sciences or leadership.
Thank you so much.
Thanks.
Have a great night.
Thank you.
Bye.
Bye.